There goes the water pig guy. Dude said his nut looks like a balloon. Ever been called names that make no sense but kinda hit deep? What if someone told you your down there looked like a balloon? What if it wasn't just a stupid rumor but your body screaming for help? Let's be real when your balls feel off. That's not just puberty messing around. That's your body raising a red flag. Called a water pig guy. Is it because your testicles are swollen? Hit the heart if you've ever ignored a weird body symptom. Drop your weirdest nickname in the comments, we dare you. It's time to stop laughing it off. It's time to stop being silent. Your health down there is no joke. Let's talk. Let's drop the awkwardness for a second. Let's talk about your balls. Yup, your testicles. You're down there, your boys. Because if one day you wake up and feel like one side is suddenly heavier, sore, or just feels like it's not your body anymore, that's not just puberty doing weird stuff, that might be your testicle raising a red flag. And the worst thing you can do. Ignore it. Medical experts, including Dr. Jason Wu, urologist at Stanford Health, explain that some of the most dangerous testicle conditions start without pain. The incubation period, says Dr. Wu, is when the body's trying to signal something's wrong, but the guy feels almost nothing. Just a bit of swelling, maybe some heaviness. Most teenage boys don't notice it, or they dismiss it. What's actually happening? Let's break it down. If it's epididymitis, bacteria are beginning to multiply in that little coiled tube behind the testicle. If it's testicular torsion, the spermatic cord might be twisting, just slightly restricting blood, but not completely. If it's inguinal hernia, part of your intestine may be slipping into the scrotum slowly before it becomes painful. If it's orchitis, a virus like mumps is just starting to inflame your testicle tissue. During this time, which can last from a few hours to a few days, the only symptoms may be a sense of fullness in one testicle, a barely noticeable heaviness when walking, a slight visual asymmetry. Most boys brush it off, but it's the most crucial window to stop things before they get bad. The pain down there isn't just random. It might be a crisis, waiting to happen. You ever hear the word orchitis and think it sounds like a medieval disease? Yeah, like something a knight would get after a dragon fight. But it's real. Very real. Orchitis is when your testicle, usually just one, becomes swollen and inflamed, often because of a viral infection. The most famous culprit, mumps. That same mumps you got vaccinated against as a kid. If you didn't, or if your immunity faded, this could come back swinging in high school or college. Orchitis has an incubation period, usually 12 to 25 days after exposure to the mumps virus. You feel nothing, maybe some fatigue, sore throat. That's it, but the virus is multiplying. It attacks the parotid glands first, hello chipmunk cheeks, then heads to the testicles in some unlucky guys, especially teenagers and young adults. Symptoms during onset: fever and chills, jaw or neck swelling, classic mumps sign, pain in one testicle, swelling that grows over hours, redness, warmth in scrotum, feeling nauseous or drained. Left untreated, orchitis can shrink the testicle permanently. It might stop producing sperm altogether. Testosterone production can also dip depending on how bad the inflammation gets, and yes, infertility is a risk. Up to 40% of guys with mumps-related orchitis on both sides will have some fertility issues. There's no cure for viral orchitis. You treat the symptoms: bed rest, ice packs, anti-inflammatories like ibuprofen, scrotal support, athletic jock or tight underwear, fluids, hydration. Doctor: Sophia Rain's infectious disease specialist says, get your MMR booster if you haven't had it since elementary school. Especially if you're heading to college, dorm life is like a breeding ground for viruses. Behind your testicle is a little tightly coiled tube called the epididymis. It's like a sperm highway. If bacteria or viruses get in there, the whole thing lights up like fire. That's epididymitis, and it hurts like hell. Real story. Tyler, 17. Tyler thought he had a groin pull from skateboarding. 3 days later, he was walking like he'd been kicked in the nuts with a steel boot. Turns out it was epididymitis from an undiagnosed chlamydia infection. I never had discharge or anything. Didn't even know I had an STI until my testicle felt like it was exploding. If it's caused by an STI, most common in guys under 35, the infection may hang out for 2 to 5 days without symptoms. If caused by a UTI or bladder infection, it can build over a week. Your only hint, a little groin, heaviness or aching. Symptoms during onset: sharp pain in one testicle, pain during urination, swollen, warm, tender scrotum, milky or clear discharge, especially if STI-related, slight fever, pain during ejaculation. Many guys say it hurts most when standing or walking. Pain worsens if untreated. Bacteria can spread to the other testicle. Inflammation may scar the epididymis. Infertility. Chronic pain can last months if damage occurs. Antibiotics are the MVP here. If STI-related, doxycycline plus ceftriaxone. If UTI-related, levofloxacin or ciprofloxacin. Ibuprofen for pain. Rest scrotal elevation. Avoid sex for 2 to 3 weeks. Partner should be treated too, or you'll get reinfected. Prevention: use condoms, pee after sex to flush bacteria. Get tested for STIs every 6 months. Don't hold your pee too long. If it burns when you pee, see a doc, don't wait. Imagine part of your intestine poking through your abdominal wall and sliding into your scrotum. Yeah, that happens. It's called an inguinal hernia, and it's more common in teen boys than you'd think, especially if you're into weightlifting sports or coughing like crazy during flu season. Real story. Jaden, 15. Jaden loved football. One practice, he felt a weird pressure in his groin. Thought it was a cramp. He kept playing. 2 weeks later, his scrotum looked bigger. It didn't hurt much, but there was a bulge, and it got worse when he stood up. Doc confirmed inguinal hernia surgery followed. If I'd waited longer, my intestines could have been strangled. I had no idea that was even a thing. Inguinal hernias can start small, a minor bulge that comes and goes, often worse after. Coughing, lifting something heavy. Standing for long periods. You might not feel pain at first, just pressure or tightness in the groin. Symptoms during onset: visible bulge in groin or scrotum, pain when bending, coughing, lifting, a dragging sensation in lower abdomen, swelling worsens by end of the day, may reduce, disappear when lying flat if left untreated. Hernia can trap intestine, called a strangulated hernia. This cuts off blood supply, causes vomiting, sharp abdominal pain, and even life-threatening sepsis. Requires emergency surgery. Surgery is the only fix. Minimally invasive laparoscopic or open surgery. Recovery: 2 to 4 weeks. Return to sports usually after 6 weeks. Prevention: lift with your legs, not your back. Avoid straining during bowel movements. Stay hydrated and eat fiber to prevent constipation. Don't ignore bulges. Early treatment does less pain. Let's not sugarcoat it. Testicular torsion is a full-on emergency. It happens when your testicle twists around the spermatic cord, cutting off its own blood supply. You have 6 hours to fix it or lose it. Real story. Chris, 16. Chris was playing video games when he suddenly felt a massive pain shoot through his groin. He thought maybe he sat wrong or pinched something, but it got worse. Fast by the time his parents drove him to the ER, it had been 9 hours. The doctors said they had to remove the testicle. I didn't even know testicles could twist like that. If I had said something earlier, they could have saved it. Torsion comes without warning. You could be sleeping, sitting, running, doing nothing. Suddenly, excruciating pain. Symptoms during onset: sudden severe pain in one testicle. One testicle looks higher or pulled up. Redness or swelling. Nausea or vomiting. Abdominal pain, No fever, no trauma, just instant agony. After 4 to 6 hours, testicle tissue begins to die. After 12 hours, 90% chance it's unsalvageable. After 24 hours, removal required. Only one fix emergency surgery. Surgeons untwist the cord and stitch the testicle in place called orchiopexy, so it can't twist again. Sometimes they stitch the other one too, just in case. Prevention. You can't really prevent torsion. Some guys are just born with loose cords. But here's what helps. Don't ignore sudden groin pain. If one testicle looks higher, go to the ER. Don't be embarrassed. You're saving your future. When is it time to stop Googling and start talking to a doctor? Let's get one thing straight. Not every ache or swelling in your balls is a 5-alarm emergency. Sometimes it's harmless, but sometimes it's not. And knowing the difference could be the one thing that saves your testicle. Or your life. Let's start at the very beginning. You feel something weird, maybe just a slight heaviness or an itch that doesn't go away. No pain yet. No fever. You think, maybe I sat wrong. Maybe it's heat rash. Maybe it'll go away. This is what doctors call the incubation phase, the time when something may already be wrong, but symptoms haven't fully shown up. Dr. Paul Bennett, adolescent urologist at Johns Hopkins, puts it like this. The most dangerous stage is when guys feel just enough discomfort to notice but not enough to act. In conditions like epididymitis or orchitis, the infection is building up silently. In inguinal hernia, your abdominal lining may already be slipping, in testicular torsion. Early minor twists can happen and untwist on their own warning signs before the major twist. Here's a fact you need to remember and probably write on your wall. If you experience any of the following for more than 30 minutes, it's time to get help. Pain that lasts more than 30 minutes. Not soreness, not dull aches from working out. We're talking about sharp-focused or escalating pain in one testicle lower, belly or groin. Pain is your body's way of screaming, says Dr. Lisa Chen, ER physician at UCLA. Ignoring that scream can cost you an organ. 2. Swelling that keeps growing. You might see some swelling after intense activity or during hot weather. That's usually not scary. But if the swelling only affects one side, grows hour by hour, gets tight, shiny, or red, then it's time to worry. It could be testicular torsion epididymitis, or even a herniated intestine slipping into your scrotum 3, redness or warmth in the scrotum. Heat in your balls isn't just awkward, it's a major inflammation clue. This is a sign that your immune system is fighting something down there. Could be bacterial infection, viral mumps, or even blood restriction torsion, warmth redness, or visible shine, screws not normal. 4. Pain during pee or ejaculation. This is where STIs or urinary tract infections show up. If you're peeing fire, or if it hurts during ejaculation, you could be dealing with chlamydia, gonorrhea, prostatitis, epididymitis. Most of these conditions can cause testicle swelling as a side effect. Real talk from Marcus 21. I was too embarrassed to talk about the burning when I peed. 2 weeks later, I was in the hospital with epididymitis. I lost 30 pounds from antibiotics, and sex hasn't felt the same since 5. Fever, pluyung, groin pain. Red alert. You're not supposed to run a temperature because of your junk. If you've got chills, fever, and groin to testicle pain, it means your body is fighting something serious. Doctors call this systemic involvement, when an infection in one part of your body is beginning to spread into your bloodstream. That's when an emergency room becomes your best friend. Let's walk through the timeline of doing nothing, because yes, a lot of guys try that route. I figured it would go away. I was embarrassed. Didn't want to tell my mom. I thought I could tough it out. Here's what usually happens instead. Epididymitis, the bacterial boom. Day 1-3, minor discomfort, swelling begins. Day 4 to 6, pain worsens, fever kicks in. Day 7 plus, abscess pus may form inside testicle. Week 2, long-term damage or infertility possible. Week 3, chronic pain, harder to treat. Orchitis, the viral rebound. Week 1, mumps, fatigue, jaw swelling. Week 2, one testicle enlarges, becomes painful. Week 3, damage to sperm-producing cells. Month 2, reduced testosterone or shrinkage. Torsion, the time bomb. Hour 1, sharp pain begins. Hour 4, blood supply severely limited. Hour 6, irreversible tissue damage. Hour 12, testicle usually lost. Hernias, the hidden danger. Early days, just a soft bulge. Later, pain increases with lifting or coughing. Crisis intestine gets trapped. Blood supply cut. Surgical emergency. Okay, let's cut the fluff. You're here because something feels off down there. Maybe it's pain, maybe it's swelling, maybe it's just this gnawing feeling in your gut that something's not right, and you're not sure if you should freak out. Google it, ignore it, or tell your grandma. So let's walk through what to do. One real step at a time. Step 1, tell someone you trust. Yes, it's awkward. Yes, you might feel embarrassed, but keeping it to yourself, that's how small problems turn into surgeries. Real story. AJ 17. AJ noticed pain in his right testicle for 3 days, kept it to himself, didn't want to make it a big deal. He thought maybe he pulled something in gym day 4. His aunt saw him limping. She asked me like, "Are you walking weird because of your shoes or your junk?" I laughed it off, but she didn't. She made me see a doctor. Turned out to be Epididymitis and caught early enough to treat with simple antibiotics. Had AJ waited another week, he risked infertility and chronic pain. Advice from Dr. Allison Green, adolescent health psychologist. If you're scared to talk to your parents, talk to a coach counselor or older sibling. Don't suffer alone. You are not weak for needing help. You are strong for knowing when to ask. Step 2. Stop lifting. Stop sex. Stop stressing it. If something's hurting, swelling, or pulling, stop. Don't try to man through it. No workouts, no jumping into bed with your girlfriend, no heavy lifting, no heat packs unless a doctor says so. Give it space. Give it a break. Real story. Malik. 19 Malik noticed a groin bulge during wrestling practice. He figured it was just strain. He iced it, wrapped it, and kept wrestling, even lifted weights 2 days later. On Friday night, the bulge doubled in size. Pain was unbearable. Diagnosis: inguinal hernia with intestinal strangulation. Emergency surgery. He couldn't walk for a week. Coach told me later, "One more day, and I could have lost part of my intestine. I felt so dumb for pushing through it." Dr. Todd Rivas, orthopedic urology specialist. Too many young men think pain is weakness, but pain is a message. Ignoring it doesn't make you tough, it just makes recovery harder. MSC Route 3. See a urologist, not Dr. TikTok. Reddit. YouTube, they're cool for snack recipes and dance tutorials. But if your testicle feels like a rock or if it's growing like a balloon, you don't need a viral video. You need a licensed urologist. Real story. Joey, 18. Joey found a lump. He didn't want to panic. He watched 15 YouTube videos and convinced himself it was a cyst. Waited 2 months before he told anyone. It was early-stage testicular cancer. If I had just gone to the doctor instead of Reddit, they might not have had to take the whole thing. He survived. But he still says that the scariest part wasn't the surgery. It was the waiting, the not knowing. Dr. Caleb Monroe, urologist at NYU Langone. The earlier we catch something, the better. Don't self-diagnose. Don't take internet advice as gospel. Come in. Get checked. 10 minutes could save your future. Step 4. Don't self-diagnose from Reddit. Here's what no one says loud enough. Reddit isn't a doctor, neither is your group chat. Symptoms can look super similar but mean very different things. A dull ache might be nothing, or it might be the beginning of torsion. A small bulge could be a pulled muscle, or the start of a hernia. A burning sensation might be a UTI, or the start of epididymitis. Real story. Devin, 21. Devin posted on a Reddit forum about his groin pain. Got 20 replies. It's probably nothing. Might be blue balls. Dude, it's just gym soreness. Mine went away in a week. He believed them. Waited a week. Pain got worse. Turns out he had testicular torsion and lost the testicle. Reddit didn't have to live with my choice, I did. Dr. Aaron Shepard, men's health researcher online. Advice is cheap and fast. Real advice is accurate and saves lives. Step 5. Follow through with treatment. Let's say you did everything right. You saw a doctor. You got diagnosed. You got meds or surgery. Now what you follow through. That means finish all your antibiotics. Go to every follow-up. Avoid physical activity until cleared. Be honest if pain returns. Tell your doctor if you're not getting better. Real story. Leo, 20. Leo had epididymitis. Doctor gave him antibiotics and said rest for 2 weeks. Day 4, he felt better, went back to work, and stopped meds halfway. A week later, the infection flared up worse than before and spread to his other testicle. It was 10 times more painful the second time, and it was my fault. I thought I was fine. I wasn't. Dr. Reena Patel, infectious disease specialist. The number one reason young men end up back in ERs for the same issue. They stop treatment too soon because they feel better, but healing continues even after the symptoms stop. If you made it this far, thank you, not just for watching but for showing up for yourself. We get it. This stuff is awkward. It's private. It's not what most guys talk about at lunch or post about on stories, but it matters because your future matters. You're not less of a man for checking your body. You're more of one for paying attention to it. Because the truth is, the strongest thing you can do is care. You're not just protecting your health today. You're protecting your future family, your confidence, your ability to show up for the people you love. Don't be the water pig guy. Be the smart guy. Drop a flex emoji in the comments if you learned something new today. Tag a friend who needs to hear this. Hit subscribe, because this is the kind of real talk we all need more of. Share this with your bros. You might just save a testicle for real.